today. This is a very nice, clear example of the effects of sodium bicarb drops on a very waxy ear. So just to give you some context and background, when you go to buy ear drops from a pharmacy for the treatment of wax, the drops that you can buy can be broadly separated into two categories. So you can have oil-based drops such as almond oil or olive oil, which soften the wax and lubricate the ear canals, or you can get water-based drops. And these aim to sort of disperse or dissolve the wax, and those include sodium bicarb. You can get drops with peroxide in it. You can get saline and purified seawater, and all manner of different concoctions and mixtures in the water-based category. And this is a very nice example because it shows what happens to earwax when you apply sodium bicarb very liberally, as this patient has done. And the result is an ear canal filled with this sort of wax soup kind of slurry. And it's a little bit difficult to suction for two reasons. The first reason is that because essentially the drops have created this sort of quagmire in the ear canal, the slurry usually travels right down deep into the ear canal and smears up against the eardrum. And what you'll see in this video is me essentially cleaning that slurry off the drum, and you'll see just here I create a little window through. So there we go, that pale grey skin there is the eardrum, but you can see most of it is actually trapped underneath this layer of slurry. So the priority during this particular procedure today is to expose as much of the eardrum as possible so that the patient can hear normally again. Now the second this very sort of this liquid mess in the ear canal is that it's difficult to get all the wax, and it's not particularly practical or helpful to get all of the wax, all of this liquid mess in there, because it will take quite a long time, and it can be uncomfortable for the patient when you're working in the last third of the ear canal. You have to be incredibly careful because it's sensitive down there. So what you're seeing now is I've switched to a slightly thinner suction tube, so it's smaller in diameter, it's less powerful, less noisy, and you're less likely to do damage with this. What I'm doing here is I'm just very gently approaching the slurry that's actually on the eardrum and just vacuuming it up through the tube to hopefully expose as much of it as possible without damage to the eardrum or causing any irritation or bleeding, things like that. And the technique is, first of all, have an extremely steady hand and good vision. In this case, because I'm using an endoscope, I have a fantastic view of the last third of the canal of the eardrum. But what I'm doing here is just very slowly and carefully approaching that residue that's on the drum. And you almost want to sort of just kiss the surface of that residue, and it will vacuum up without actually doing any damage. So it's the bottom left that I'm going to go for now. I'm just going to very gently touch it, and you'll see all of that sort of slime essentially vacuum up and come off the eardrum. And there we go. And then underneath you have nice pale grey skin, which is nice, so it's the right colour. There's no inflammation. On the top left, same situation. What I'm looking for really is the handle of the malleus, and the handle of the malleus is part of the first bone of the middle ear, and you can usually, in photographs of eardrums, you can actually see it sort of sticking out of the eardrum. Now this is a left ear, so I'm expecting the handle of the malleus to present sort of tilted to the left, sort of around 11 o'clock. And you can just about see it here, it's not super clear, but you can see sort of this ridge at 11 o'clock coming out of the eardrum. And then again, just trying to clear some of that liquidy slurry off the top of the drum. And you can see here just how much sort of residue is stuck